Thank you, Mr. Cruz. We will now begin a round of questions. I am going to ask consent to include in the hearing record the letters of support that we have received for Mr. Cruz's nomination, so they will be included. Let me ask first about the dual role that you will be taking on. You're going to continue to serve as Secretary Kennedy's senior advisor for Indian Health while also leading IHS. Obviously, both roles are critically important. IHS is central to fulfilling the federal government's trust responsibility to provide the health care to American Indians and Alaska Native, but many issues that impact tribal communities extend well beyond IHS and across HHS. We were talking about them just yesterday. It's everything from Head Start, it's LIHEAP, it's some of the domestic violence programs, child welfare, homelessness. There's so many other areas. Now, HHS is, I was going to say undergoing, but they have announced a pretty major reorganization. We held an oversight hearing here in the committee to ensure the federal trust responsibility and the tribal programs were protected throughout any restructuring. But one of the things that we heard very clearly at that hearing was that tribes need strong advocates within the department who understand how decisions across HHS impact our Native communities. So can you just speak to first of all, this dual-hatted responsibility that you have, but also how you will elevate tribal issues across the entire department, and as there are discussions about organizational changes within HHS itself, how we ensure that not only it's meaningful tribal consultation, but protecting these programs that serve Native communities. So often the programs themselves don't have tribal in the title, but again, the impact to our Native families is quite considerable. Can you speak to these issues? Thank you.
Yeah, thank you, Chair. First to your question about the dual role. The Secretary created this senior advisor position, and I'm the first such to do this job. And so we're still figuring out a lot. But as you mentioned, there's a lot of work of tribal affairs in the different operating divisions. A piece of my work in that role has also been to work closely with the Indian Health Service. Thankfully, we have a couple of political appointees there. One of my hiring philosophies is to hire people smarter than myself. So we have Dr. Hartwig, experienced family provider, and Clayton Fulton, lawyer, who are helping within Indian Health Service. If confirmed, I would look forward to closely working with them and taking on some more of those management responsibilities that the IHS director is responsible for. But what's surprising to me is that it's taken so long for that senior advisor position to be created, but it's also surprising to hear that the IHS director hadn't had a meaningful role with the secretary prior to this senior advisor role being created. So in a way, if confirmed, I would be dual hatting, but I would essentially be preserving that close relationship with the secretary. And as we manage within the departments, that is just a critical relationship to have, because we do hear about a number of issues from tribal leaders and tribal health departments and our urban partners about issues that are occurring in different operating divisions. And in my current capacity, I get to troubleshoot that. In a future capacity as director, again, if confirmed, I would continue to do those things and advocate even more ferociously for the equities of our tribal partners and our urban Indian partners. So I see them as very complementary. The IHS director is an important advocate for Indian country within the department, and I think that both are achievable and they're not mutually exclusive. And the final point is, I also hear all the time about the silos that HHS has artificially created. We get it in QFRs. We've seen it in GAO reports. The beauty of this role would be to be able to navigate between OpDiv and OpDiv and be a part of budget formulation conversations in ACF, in other operating divisions. And so I look at this as a positive and a win for Indian country.
Well, it is a challenge, and it's one that I hope every morning you wake up and you think, how am I going to reinforce the tribal priorities at all these levels within a massive department where most of the people around you are not focused on the needs of Indian country. And so for you to be that advocate within the department and continuing this role as senior advisor, I do think is important. I think it's pretty telling that you note that there has been somewhat of a disconnect, I'll just phrase it that way, between the IHS director and the department itself and the secretary's office. And maybe that's why we have struggled sometimes over the years with just a lack of connectivity there. So we're putting a lot on your shoulders here, but making sure that you are first and foremost thinking about tribal interests and the interests of Native Americans, Alaska Natives, and Native Hawaiians every day.
Absolutely.
is where we want you to focus.
Absolutely.
Vice Chairman.
Thank you, Mr. Cruz. Thank you for being willing to serve, and thank you for the conversation yesterday. We talked a little bit about the IHS staffing problems, and under the current administration, IHS's attrition rate reached a 4-year high, 15.3% in 2025. You know what this does to service delivery. We talked yesterday about housing, about pay scale, about Indian preference in hiring. But in the written correspondence, you tended to focus a little bit more on Indian preference in hiring than the other things. And I told you I was open to modifications if they were a real impediment. I just don't want them to be the scapegoat. It seems to me that if you're being asked to hire, to look first at a tribal member, that's sort of intuitive anyway, because it's hard to keep people in these jobs in healthcare. And to the extent that they belong to those communities, they tend to stick around. And so it's just a smarter investment. But nobody's prohibited from hiring someone who is not a tribal member. And so I just wanted to put a fine point on what do you actually think the problem is with the IHS staffing shortfalls?
Yeah. Thank you, Vice Chairman. As I noted, this has been a long, persistent challenge of the Indian Health Service. And in my current capacity as senior advisor, I've worked with the Indian Health Service team to understand why, for decades, we've heard of this vacancy rate fluctuate. And we can, and, GAOs look, independent observers have looked at this. And as we noted, it's a number of factors, housing opportunities, education opportunities, a variety of factors. But when I really push back, those are well documented, again, for a while. But then I see my 638 tribal partners who also have a duty to hire and provide direct services. Why is their vacancy not 30%? So that's where I want to look to their expertise, their experience, and then ultimately their flexibilities that IHS isn't subject to. So the more we can bring authorities and flexibilities to IHS to end this long time vacancy rate, the better. And if it's a matter of our hiring managers, being overly cautious, I want to understand why and where that comes from.
Yeah, the other thing is under 638, you can do different things, right? The pay scale's different.
Yep.
That's probably the main thing. Like intuitively, if you're trying to fill a job, the more you pay, the more applicants you're going to get.
Absolutely.
And so the 638, that authority is, to me, probably the dispositive one. They can hire J-1 visas and they can provide additional benefits. And so the reason I care so much about this is frankly twofold. One is like, this is the problem, right? You can't run any healthcare delivery service with a 15% attrition rate. And so it's extremely important that we actually identify the rate limiting factors and not the potential scapegoats.
Mm-hmm.
And one of the things this committee has been very good about doing is sort of whatever disagreements Democrats and Republicans have or may have had in the past or continue to have regarding DEI and all of that, we sort of hold harmless what we're up to because of trust and treaty obligations. And so I was a little worried that it was like it's preferences in hiring, and then we're down a road where there's a whole sort of swarm of internet trolls on both sides of this equation, and we're not like figuring out what's the damn problem.
Yeah.
It seems to me, if you're talking about flexibilities, it's not necessarily that 638 has unique flexibilities on hiring preferences, but just they can pay more, provide more benefits, and hire different people. And so I just want your commitment to attack this problem as if I didn't know which political party you belong to, because that's my expectation for you as IHS director.
Thank you, Vice Chair. You have my commitment to work with you on it. Like, longstanding problem that I want to get after, and I want to just be honest about the situation. And at the end of the day, my priority, if confirmed as director, is patient care. I'm tired of visiting facilities where they've had double-digit vacancy rates, and I really want to work closely with my team. I've been a fierce advocate internally for hiring exemptions and put together a robust 2026 hiring plan. So this is going to take time. We didn't arrive here in 18 months, and it's going to take a concerted group collaborative effort to get out of it. So I look forward to working with you and your team.
One final question. Do we have your commitment to be responsive personally? If any member of the Indian Affairs Committee has any question, will you call them back within a reasonable time frame?
Yes, Vice Chairman.
Thank you.
Thank you. Senator Smith.
Thank you, Chair and Vice Chair, and welcome to the committee, Mr. Cruz, and thank you for our conversation last week. It was very helpful to me. So here's what I'm wrestling with. You clearly have an understanding, a firm understanding of the federal government's trust and treaty obligations to tribal nations and to Native people, and you have the support of tribal leaders in Minnesota, which is, of course, very important to me. Yet you also have served as senior advisor to Secretary Kennedy during a time of great tumult in the department. This administration has gutted public health, health research, mental health programs, which in my view has caused real harm to Native communities, even if IHS was spared. And as you have said, the Department of Health and Human Services touches all aspects of life for Native people, it's not just the IHS. So I'm trying to reconcile this, and I want to ask a couple of questions to try to get at this. The first question has to do with the 1115 Medicaid waivers. Okay, so we know the Centers for Medicare and Medicaid Services recently published guidance implementing a provision of the One Big Beautiful Bill that makes it harder for states to offer services like traditional healing and Medicaid programs. But essentially, states are now being required to resubmit existing 1115 waivers and prove that a service is budget neutral. And you've touted the use of these waivers to expand access to traditional healing. So can you talk about this? How would this new budget neutrality requirement, have an impact, or how might it impede access to services like traditional healing?
Mm-hmm. Thank you for that question, Senator, and I really appreciated our conversation and the heartfelt nature of it. Specific to your question around the Section 1115s, so I am generally aware. I don't work at CMS directly. I wasn't involved in that rulemaking. However, I have seen correspondence from tribal organizations that have provided their views and feedback on these regs. Some of it's been positive. Some of it has asked for additional work. I will work closely with the DTA team to understand what that budget neutrality actually does for the traditional healing. But the secretary and I have been supportive of those methods.
Okay.
It's kind of a all hands on deck. What we know is what works for one person may not work for another. So that's why we've been supportive.
Well, we can follow up on that
so
and further that conversation. I think it's an example of why it's so important that these sort of broad-based changes in Medicaid that have a big impact on Native communities, that is well thought through. Let me follow up just a little bit more clarity on the question that Senator Murkowski was asking about dual roles. So which office will you work out of? Will you work out of IHS, or will you stay in the Secretary's office? Like, how will that work?
So thank you, Senator. A lot of the those logistics we're still working out, if confirmed, right? It's predicated on a positive vote. If confirmed, I will be showing up in Rockville. That's the duty station of the Indian Health Service Director. I've also know that I will keep an office near the Secretary, where the one I currently occupy.
So you would imagine going back and forth a bit?
Yeah, absolutely. And a lot of our leaders do. I see our HRSA administrator, I see our CMS administrator, and we have our all politicals meetings. Oftentimes senior leadership from different optives are staffing the secretary in meetings or briefing him. And so having presence is important.
So you would continue, and then will you be paid out of IHS or out of the Secretary's office? Is that figured out yet?
We haven't figured that out, but my understanding is if I encumber the IHS position, I would have to be paid out of IHS.
Okay. Senator Schaas was getting at that a little bit, but getting at this next question a little bit. It has to do with big hullabaloo at the beginning of the Trump administration about how there was sort of a blanket, all DEI initiatives are bad and need to be thrown out. This happened everywhere, and it was really, in my view, very unfortunate how Native people got caught up in that, as if providing particular attention to Native people was part of some broader DEI initiative. Can you just commit that in this role that you will ensure that programs that are serving tribes in the Native Hawaiian community are not considered DEI or sort of cut because of the misconstrued connection between DEI and those tribes and those programs?
Yeah, I'm aware of the DOJ clarification last spring, and I will support the trust and treaty responsibility that the federal government has for tribal partners.
Okay, and just one last quick question. Will you support advanced appropriations for IHS and strong funding in upcoming budgets?
I support the president's budget request that does include advanced appropriations.
Okay, I have a follow-up question on urban indigenous communities, but I'll submit that to the record. Thank you.
Thank you
very much.
Thank you, Senator Smith. Senator Lujan.
Thank you, Madam Chair. Mr. Cruz, good morning. And
good morning, sir.
Thank you for taking time to come by the office. Very much appreciated the conversation. As you've heard from all of my colleagues, I share with Democrats and Republicans here how important IHS is to our constituents, to the people that have entrusted us with these responsibilities. In New Mexico, you're familiar. You've visited recently to the nation, to the Navajo Nation, as well as a few other sovereign nations as well.
Yes, Senator.
As you know, IHS serves as a backbone of healthcare for communities. And I remain concerned anytime I get a call from a constituent or see someone at their home, or if they stop by and visit me because they see me out on the farm doing something and tell me what happened, and it's not a good story. Nowhere is this more evident than at the Gallup Indian Medical Center, which we spoke about in my office.
Yes, sir.
One of the largest native serving medical facilities in the entire country. Now, GIMC contends with persistent drinking water issues, as you're aware. People from IHS have visited over there. As a matter of fact, when I brought up in a hearing here that that there were signs around the hospital that people shouldn't drink water, someone from Washington, D.C. ordered them to take the signs down. Not fix the water problem. Take the signs down. That's not leadership. That probably put some of my constituents in harm's way. Now, I hope that the United States knows that we cannot allow a facility of this importance to keep operating under these conditions. Getting a new facility built is not optional, it's imperative. As I've shared with you, this facility was left out of the FY27 budget because it was deemed not quote, shovel ready. So my question is, in this new role, will you commit to working with the Navajo Nation to ensure that the project is shovel ready so that it will be included and it is ready in time for the next budget cycle?
Senator, thank you. I really enjoyed our conversation and specifically about my visits to your state. When I walked in my current capacity as senior advisor, one of the areas I wanted to look at was our construction program, because there's no more direct signal of one's commitment to health than a modern, clean, safe facility. And when I saw that IHS had 8 projects on their 1993 list, my jaw dropped. And unfortunately, Gallup Indian Medical Center is one of those projects on that list. And I asked the basic question, why has it taken 33 years to clear this list? And what is the plan of action? And so what I can share is I want to make sure that those remaining projects get on a path towards completion. So whether it's environmental review, permitting, I want to understand that. If it's design, build, I want to understand that. And then I'm also actively monitoring where projects such as the one in White Mountain Apache are. So from being on the list through ribbon cutting, I want to know where each of those are. And then I also want to know where the resources are going to come from to finish those projects. I have fundamental issues with the way the federal government completes Indian schools, Indian justice centers, Indian hospitals, and clinics. We pay with cash up front. It's just not a very efficient use of a big capital with big facilities. And I think that's been part of the challenge we've seen over 33 years and why it's taken us this long to get where we are. So yes, I am firmly committed to putting those projects on a glide path out. It's going to require resources. There's no bones about it. The latest estimate I received to get those 8 projects done was $8 billion. My annual appropriation in that line item is just under $200 million. Doing quick math, it's going to take us about 40 years to get those 8 projects done. That's unacceptable.
So is this a flaw in the budget? Did the budget leave these projects out? And is that something you'll advocate to correct and and ask for $8 billion in the president's budget? Because the president's budget didn't ask for $8 billion.
So, Senator, what we did was within the authorities that we have at HHS, we created a $1 billion NEF commitment. So that was a strong step by the secretary to recognize and acknowledge that problem. And then I look forward to working with my colleagues at OMB to...
Mr. Cruz, sorry to interrupt there. My time's running out here. If the problem is $8 billion, if that's the need, then the request is $8 billion.
I look forward to
it's not $1 billion so we can say we're going to do better. That's failing. And I'll blame every other president, every other administration that came before the 33 years. They didn't fix it either. Mm-hmm. I'm here now. You're here now. President Trump is here now. Yeah. Secretary Kennedy is here now. Are we going to fix it, or are we going to come back in here and say, well, we put another $100 million. We're not making anything better. And so I hope we can get there. Yeah. The last question I have here, sir, I also want to thank you. I raised an issue with you and your team about a position that was taken by HHS and IHS with the sanitary entity about what I would call a bad decision, an arbitrary decision about treatment of GRT to Santo Domingo Pueblo.
Yes, sir.
After we met, I was informed that Santo Domingo Pueblo got a letter or a communication that said that notification, that internal guidance memo was rescinded. Is that true?
Yes, Senator.
I want to say thank you for that. And to all my colleagues, just as we fix tax issues, I certainly hope that we can do a policy change here so that this confusion is not created at any one of these facilities again to misspeak over tax treatment to sovereign nations as well. And Mr. Cruz, I won't ask you this in the hearing. I asked for you to respond in writing, but is there any action that's been taken by Secretary Kennedy while he's been Secretary of IHS or HHS and IHS under him that you disagree with? And I have a list of terminations, problems across the country. I'm really interested here because this will help us understand the priorities that we can expect to be addressed. And Madam Chair, as I turn my time back to you and as it expired, I also want to say that maybe Mr. Cruz should have been nominated as Assistant Secretary of Indian Affairs. And the reason I say that, when Senator Smith asked him a question about making a commitment to consultation with tribes, Mr. Cruz didn't hesitate. He said yes. I'm still waiting for the Assistant Secretary of Indian Affairs to say that he will commit to consultation with tribes. And I just don't know why that's hard. So I want to commend you for your response today as something that we should all take seriously with consultation for that. Thank you for the time, Madam Chair.
Thank you, Senator Lujan. Senator Cortez Masto.
Thank you, Mr. Cruz. Thank you. Along with my colleagues, I so appreciate you meeting with me and taking the time. Congratulations on your nomination. Let's talk about the dual role. One thing we didn't talk about, I think there is an opportunity with this dual role that you have. I'm conflicted as well because I think there's going to be times when the secretary is going to be issuing some sort of edict, which may conflict with Indian country, and you're going to have to make a decision. Mm-hmm. But there's also an opportunity here, and I want to put this in front of you. Senator Rounds and I introduced a piece of legislation that's called the Stronger Engagement for Indian Health Needs Act. And what it actually does is it elevates the IHS director position to assistant secretary. Why? Because right now, in addition to the workforce recruitment and retention challenges, IHS leadership can't directly hire or fire their own employees. You don't have a lot of authority to do anything. And by elevating it to assistant director, I'm hoping it addresses a lot of the challenges we're facing right now. So you have a great opportunity in your senior advisor role, along with what you're doing now as the director of IHS, to see if that should be elevated. There's legislation out there. I would ask that you would consider that and take a look at the legislation and let us know and report back to us if that makes sense. Would you be willing to do that?
Absolutely, Senator, and really enjoyed our conversation and the needs of the Nevada tribes. Angie's in the room here with me, so really glad that I have her counsel on speed dial. And yeah, absolutely happy to look at that. If confirmed as director, I want to understand my full hiring and firing authorities, and if there's legislation out there that would potentially give any IHS director those authorities, happy to review that and work with you and your team.
Thank you. I want to talk a little bit about the staffing that you and I had talked about as well. My understanding, IHS already faces a 30% staff vacancy rate and chronic underfunding, as we have talked about. Because of this, and this is something that's consistent, and I'm going to agree with my colleague, Ben Ray Lujan, it's consistent under any administration right now. This is our frustration. And so because of that, Mark Wayne Mullen, when he was here, we introduced a piece of legislation called the IHS Workforce Parity Act. And that's to strengthen recruitment and retention by providing greater flexibility for providers in IHS. Mm-hmm. So I would hope that you would be willing to look at legislation or some opportunity to work with Congress to help strengthen that recruitment and retention. Mm-hmm. That's going to be your biggest problem, as you well know. You and I talked about in the provider country, not just finding the providers, but in geographic locations. You know, some of our tribes are 3-4 hours away from an urban area. Mm-hmm. It is very challenging. So I'd hope you'd be willing to consider legislation like the one I've introduced with Mark Wayne Mullen.
Yeah, thank you, Senator. It's a persistent challenge, well-documented problem. I'm willing to look at all methods to reduce that vacancy rate, get more people into our hospitals and clinics to provide these services. I'm supportive of education pipelines. We just signed off on a wonderful partnership agreement with Haskell Indian Nations University in Lawrence, Kansas. We worked jointly with the Department of the Interior on some land. We're going to build a bigger clinic on campus there, and we're also going to get more nursing students. If confirmed as director, I'd love to work with organizations such as AHEC and identify where can we get more nurses, where can we get more behavioral health specialists, where can we get more dentists. So I'm very eager. Where I see challenges, I also see opportunities, and that's why it excites me. And I wake up every morning knowing that I get to advocate for Indian country and be that ambassador, if you will, within the department and build those relationships. Because governing is relationships. And I feel like in the year in my current capacity, we've shown some success and a few wins. We've had a secretary that's engaged more with Indian country than any of his predecessors. And so I'm really looking forward to going through this process, and if confirmed, continuing and taking that to the next level as IHS director.
Thank you. And then we also talked about this, and I need your thoughts and commitment on addressing this issue. Throughout my career, protecting children and other vulnerable populations has been a core priority.
Mm-hmm.
Given past high-profile failures within Indian Health Services involving the sexual abuse of Native American children by medical providers, ensuring safety and accountability is a top concern. And so my question to you is, if confirmed, what specific steps will you take to ensure that IHS facilities are safe environments for children?
Absolutely, Senator. I take this issue very seriously. I find it repugnant, and it's some of the darkest pieces of our society. And if confirmed as director, I will utilize every authority, any legal authority under the director's purview to root out that disgusting and despicable behavior. I will have zero tolerance towards any matter that I become aware of. And we'll make sure that under the processes laid out in IHS, that if it's criminal referral, that happens. If it's active investigations, that those occur. And they occur in a timely way that's responsive to the victim and their families.
Thank you. Thank you, Mr. Cruz.